Hi, I'm Dr. Anna Battat. I'm an anesthesiologist on the medical staff at Penn Medicine Princeton Health. Today, I'm going to discuss how managing pain following a knee or hip replacement is key to a quicker recovery, allowing you to rest and to move the joint more comfortably. Every day, you use your hips and knees for walking, climbing the stairs, getting in and out of your car, and other daily tasks. You may not give it much thought, but if your joints are not 100%, even little movements can cause you discomfort and pain. If significant joint pain, deformity, or disability are affecting your quality of life and limiting your daily activities, you should see your doctor for a complete exam. The next step will likely be x-rays of the joint to determine how much it has degenerated. Your doctor may start treatment with a less invasive approach to restore the joint's range of motion and reduce pain. This might include anti-inflammatory medicines, joint injections, and physical therapy. If these methods don't offer relief, you may want to consider hip or knee replacement. Joint replacement surgery can provide a safe and effective remedy and get you back on your feet more quickly than you imagined. At the Jim Craigie Center for Joint Replacement at Princeton Medical Center, some of our surgeons are performing joint replacement procedures on appropriate patients with enhanced precision using robot-assisted technology rather than more traditional techniques. The precision of this approach may allow the patient to benefit from fewer complications, more precise implant positioning, and the potential for faster recovery with less pain. And highly motivated patients who wish to achieve a rapid recovery and who have a dependable support network at home may qualify for same-day, minimally invasive outpatient procedures. While it's natural to experience some degree of pain after a surgical procedure, proper management of that pain can help alleviate post-surgical stress so you can rest comfortably, decrease your odds of complications after surgery such as blood clots, and promote blood flow, all of which help the healing process. At the Craigie Center, an individualized pain management plan is developed for each patient weeks before the surgical procedure takes place. We begin at the preoperative testing stage, discussing any special challenges the person may face regarding pain management. For example, we check for sensitivities or allergies to certain medications, whether the person has been chronically using pain medication, which can mean they may have developed a tolerance to the medication, and whether there is a history of opioid use disorder. While most patients may need to take an opioid briefly to manage pain following a joint replacement, every effort is made to limit their use. While the need for medication depends on the individual, for some hip replacement patients, opioids are only needed for a few days or not at all. For a knee replacement, some patients may need to take medication for a few weeks. We focus a lot on non-narcotic pain medications, nerve blocks, and icing to help reduce pain and swelling. We also use spinal anesthesia in the operating room, which helps reduce pain in the early recovery stage. When a patient does need to use an opioid for a short time, we provide guidance on the usage and tailor it to their needs. Additionally, when leaving the hospital after a joint replacement, patients are given guidance on how to properly dispose of any leftover prescribed opioids. For the majority of our patients, joint replacement makes a dramatic improvement in their comfort and mobility. If you or a loved one are facing joint pain, the experts at the Jim Craigie Center for Joint Replacement have a comprehensive program to help eliminate your pain and restore your strength and mobility, so you can reclaim your life as soon as possible.